The Liberty trifocal intraocular lens is a single-piece hydrophilic intraocular lens which has been designed for implantation in the capsular bag. This hydrophilic IOL has a 25% water content. It has also got a UV absorber and a blue light filter, and it has a refractive index of 1.46 and a very high Abbe number of 58, thereby reducing the chromatic aberrations. It's a biconvex aspheric diffractive refractive apodized trifocal intraocular lens. The power ranges are available from 8 diopters to 35 diopters, and the toric lenses are available from 1 to 6 diopters. It has an A constant of 118.9 and it has an overall diameter of 13 millimeters with a central optic of 6 millimeter. The interesting part of the trifocal intraocular lens from Liberty is that it is a mixture of refractive and diffractive. Of the optic, which is of 6 millimeters, this 75% is the refractive component, whereas the central 3 millimeter of the optic contributes to 25% of the diffractive component. These central diffractive rings are apodized, and it has got two orders. The 0 order is for far, and the first order is for near vision. It has got a near vision add of 3.5 diopters at the lenticular plane, which translates to 2.7 diopters at the spectacle plane. And similarly, it has got an intermediate addition of 1.75 diopters at the lenticular plane, which translates to 1.35 diopters of intermediate vision at the spectacle plane. We conducted a prospective single-center long-term clinical study looking at the visual and the refractive outcomes of the Liberty trifocal intraocular lens. This study was published in the Journal of Cataract and Refractive Surgery in 2019. This study included 100 eyes of 50 patients who were prospectively followed up over a period of 2 years. Apart from looking at the visual acuity, we also looked at the refractive outcomes, the defocus curve, the contrast sensitivity, both in photopic, mesopic, and scotopic conditions. We also looked at the light scatter and the patient satisfaction questionnaire using the VFQ-25. This 2-year study was further followed up by a prospective study looking at the 5-year visual and the refractive outcomes. This is currently in press with the Journal of Cataract and Refractive Surgery. Once again, at the 5-year study, apart from looking at the visual and the refractive outcomes, we also looked at the visual performance through defocus curve, contrast sensitivity, light scattering, posterior capsular opacification formation, and finally patient satisfaction questionnaires using the same VFQ-25, which was used for the 2-year study. This is the defocus curve of the Liberty trifocal intraocular lens. The lines in blue depicts the defocus curve at year 1. The lines in red depicts the defocus curve in year 2, and finally the black lines represent year 5. As you can see from this defocus curve, this lens offers good, excellent distance, intermediate, and near vision starting from year 1 right up through year 5. So both from the prospective 2-year and the 5-year study, we were able to show that the Liberty trifocal intraocular lens provides excellent unaided distance, intermediate, and near vision. In addition to the visual results, the contrast sensitivity was excellent in all conditions, photopic, mesopic, and scotopic. And because of the centralized diffractive rings, the amount of glare and halos reported by the patients were very minimal. And the 5-year study showed that the PCO rates were very low, with the YAG laser rates of 21.9% at year 5.
Pottery has been my hobby for about 20 years. I first realized something was wrong a few years ago. Making my figures became more and more difficult.
One thing that I love doing is just sitting down, relaxing, and going through our photograph albums of the family. And bit by bit, I began to realize that I was having problems telling who was who.
I had the earlier signs of macular degeneration. Although I can see where I'm putting the brush, I can't see after I've done it what it looks like. And so I'm unable to paint properly, which meant virtually that I had to give it up.
In an ever-aging population, age-related macular degeneration is still the leading cause of irreversible blindness in the industrialized world. As the number one cause of visual impairment amongst persons aged over 75, it is a great concern in public health. For exudative AMD, treatment options have been revolutionized over the past decade with the introduction of intravitreal injections of antivascular endothelial growth factors. While the treatment for exudative AMD is widely available, reduced near visual acuity is still a growing problem for patients with macular degeneration. A number of external magnifying devices are currently available for use, but these have limited acceptance by some patients.
Even with the magnifier, I found it difficult to read newspaper print, especially any article which included long words. The end of words tends to disappear completely.
An ideal intraocular magnifying device should have the following characteristics. It should provide sufficient magnification, it should be easy and safe to implant, and be independent of the lens status of the patient. It should not reduce the distance vision or the visual field in the implanted eye, and it should be reversible and also affordable. One such device, developed in cooperation between Professor Chariot and Medicontur Medical Engineering, is the Chariot Macular Lens, also known as the SML. It's a single-piece hydrophilic IOL with a water content of 25%. It has an overall diameter of 13 mm and an optic size of 6 mm. The central 1.5 mm of the optic has a power of 10 diopters, while the rest of the optic is plano. This IOL is implanted in the ciliary sulcus as a piggyback IOL. It has a 4-point fixation with flex haptics. This non-torque design provides excellent stability. It has a convex-concave optic and a 360-degree polished round edge to prevent iris chafing. The central optical portion that provides the magnified image will dominate when the patient focuses on near objects only, but will not influence far vision significantly when the patient focuses on distant objects through a dilated pupil. The proof of concept on this device was first published by Professor Chariot in the August 2015 issue of the Journal of Cataract and Refractive Surgery. Recent human cadaver studies have shown that SML sits very nicely in the ciliary sulcus, providing good clearance from the primary IOL in the capsular bag due to the convex-concave optic configuration. Following ethics approval in April 2015, a prospective European multi-centre clinical trial was launched in October of the same year on the visual and refractive outcome of SML implantation in macular degeneration. For this trial, 50 patients have undergone monocular SML implantation. Following a clear corneal 2.2 mm incision, OVD is injected in the anterior chamber. The SML is loaded into a special custom-made cartridge. and is atraumatically injected in the ciliary sulcus.
It's quite a scary thought that somebody is going to operate on your eyes. But the clinic were fantastic, and there was real support, real encouragement. And the surgery itself, I have to say, was completely painless.
3, 6 and 12-month follow-up data show that the SML provides excellent improvement in uncorrected near vision in the implanted eye. This improvement strongly corresponds with preoperative testing with +6 diopters. Predictability of a post-operative outcome based on the preoperative testing has proven to be crucial for indication, communication with patients, and giving them realistic expectations. As expected, the SML did not affect the corrected distance vision in this group of patients, as this implant is designed to only improve the reading vision. There was no change in the intraocular pressure over a period of 1 year following the implantation of the Chariot macular lens. To reach optimal reading performance, patients are required to undergo 2 to 3 weeks of training.
I had to train my mind and my eyes to accept these new lenses. This involved reading text for about 20 minutes a day. Vision is just so important to everyone, to everyday life.
Guess what? I'm back making pottery again.
This slide shows the clinical results of the Chariot macular lens, which was implanted in patients with age-related macular degeneration. These are the results of a prospective European multicenter clinical trial, which is available for a free download in BMJ Open Ophthalmology, published in 2019. The unique platform of this first Q add-on family provides several optical solutions for patients. It can be used as an add-on solution for purely refractive, as a monofocal lens, or as a monofocal toric, or as a trifocal toric for patients who want a presbyopia solution, having been previously pseudophakic with a monofocal intraocular lens. The first Q add-on trifocal intraocular lens provides a unique solution, offering a piggyback solution for presbyopia for patients who have been previously implanted with a monofocal intraocular lens in the capsular bag. These add-on lenses have been uniquely designed for specifically to be implanted in the ciliary sulcus as a secondary or a piggyback option. As you can see from this cartoon, the lens has got a 4-point fixation with quite flexible haptics, and also got a convex-concave configuration so that it does not come in touch with the primary intraocular lens in the capsular bag. It provides stable position, and there is no change to the intraocular pressure, and offers a unique reversible solution where these lenses could be easily explanted as easy it is to be implanted in the ciliary sulcus. The stability of these add-on lenses were demonstrated in a unique lab-based post-mortem cadaver eye study where these lenses were implanted in the human cadaver eyes in the ciliary sulcus, and anterior segment OCT was performed. This study was published in the Journal of Eye in 2017. So the add-on trifocal intraocular lens has got a very similar optical design and visual performance as the Liberty trifocal intraocular lens. These add-on trifocal lens not only comes as a trifocal option but also as a trifocal toric, providing a unique solution for presbyopia correction in patients who have been previously pseudophakic with a monofocal intraocular lens. Thank you very much for your attention.